Hey everybody, it's Dr. Seiler again from Seiler Skin. So welcome back to our second video in our series of 2 videos on the vampire facelift. If you happen to miss yesterday's video, we shot the first part of the video with the blood draw and injections into the face with all the filler that we did. We used a little bit of Illumine Juvenin to really nicely pick up the cheeks and help her around the mouth. We just showed her what she looked like after the filler in the mirror, and she was really impressed already, even though she's nowhere near the result that she's going to get as months come. So now this is our platelet-rich plasma. This is all of the growth factors and healing elements in your blood that we take with a simple blood draw, and we use a sterile centrifuge through an FDA process, FDA-approved process, to concentrate the PRP, and then we inject that back into the tissue. Like she was asking me a minute ago, she was asking where do we inject the PRP and why, and we really hit all of the deeper structures in the face, so the fat pads, to give some volume and some lift. It makes me not have to use as much filler. It really helps under the eyes and around the mouth, so it's a great complement to the filler that we're doing. So we're going to get started here. We've got a very concentrated amount of PRP, so we have put just a little bit of a numbing agent and bicarbonate just to keep it from stinging. And we're going to kind of get started here in the cheek, and you'll see that we inject a lot of the same areas where we inject filler. Filler in the cheeks goes very deep, so you kind of get under all layers of tissues to lift up. And then you can complement that by really stimulating the fat pads with the PRP. And over the next 6 to 12 months, you'll see just a nice improvement that just kind of keeps lifting the face and making her better and better, and really makes patients happy with the longevity of it. You feeling that much now? Just a little pressure, not bad. Okay, good.
So who's a good candidate for the vampire facelift?
So really there's a lot of patients are, it's a great question, but there's really not many people that aren't a good candidate for it. It's always better to do PRP injections along with filler than just filler by itself, unless maybe you're doing the lips. Lips usually you can just put a little filler in and they don't necessarily need PRP, but it's great for a patient that's starting to see a little bit of volume loss, that it keeps you from having to do as much filler. It's great for a middle patient, middle-aged patient, even 30s, but certainly 40s, 50s, 60s, somebody that doesn't need surgery, that wants to see some lifting in the face. And again, a lot of patients come in with complaints of what we call nasolabial folds, when what they really need, instead of just injections right there, is lifting in the upper cheek. So unfortunately, I think a lot of injectors don't really know to look at the proportions of the face and need to learn that, so that's what we're trying to teach them in our training, so that they really globally assess the face and know what all areas they need to inject. And then, even in a patient in their 60s or 70s that doesn't want or need surgery, we can evaluate if they'll still get a good result with this procedure. It's good for men and women. It's good for patients of all ethnicities. All skin types, all skin colors, so it's really good for just about anybody.
Is this a safe treatment? Can you talk about the safety of it?
Yeah, so I always say when patients ask that question, in the right hands, yes, this can be a very safe treatment. And somebody that's very skilled and understands not only how to properly inject, one of the biggest things that I think patients don't know is that there are structures in the face that you certainly can hurt and permanently injure with improper injection technique, especially with filler. And so you really have to go to somebody that really understands the anatomy. We were talking about that earlier when we were off camera, about all the blood vessels and whatnot in the face. And so you really have to go to somebody that knows what they're doing. But yes, in the right hands, it's very safe. You can see on camera right now that we've already put filler all through her cheeks, under her eyes, and around her mouth, and you can't even tell where I've done it. She really, knock on wood, didn't have a drop of blood. Kayla's looking at me like, oh no, now he's gonna bruise her on this next little stick. But it really does make a huge difference in knowing where to inject and being safe. So yeah, to shortly answer your question, it's a very safe treatment in the right hands.
And what about the safety of PRP itself?
Yeah, it's a great question. Platelet-rich plasma has been utilized in surgery to begin with, but in the vet literature, the dental literature, for decades now. I used it in the wound healing center when I was in surgery residency 15 to 18 years ago. There are close to 20,000 studies in the literature that have studied PRP in all the different specialties, not only to prove its safety, but its efficacy and its result. It's what you hear the orthopedic surgeons injecting into joints to help with tissue repair. think it's important for patients and injectors to understand that this is not stem cells, so we're not growing anything new. This platelet-rich plasma is completely different. It's simply all the healing elements in your blood that will help heal tissue, stimulate collagen. So it's your own stuff. We take it out of your blood, we concentrate it sterilely, and again through an FDA-approved process, like I said, and then we re-inject it. I think one other thing that's important to know is that this should not be done in a general lab. So some people that do this procedure that are not certified to do it and are not doing it correctly are simply just drawing blood with their normal blood draw kits and spinning a bunch of syringes, test tubes down in the centrifuge and drawing the PRP out of that. And that's not an FDA-approved process, and it's not been tested and proven safe to re-inject it. So you shouldn't just be drawing platelet-rich plasma out of a tube in a lab and then putting it back into the patient.
Another thing, what can she expect result-wise? What's the progression that she'll see in her result?
Sure. So we always tell you hurting at all?
Not at all.
Okay, good. So I sit there a little bit. We always tell patients to remember the number 3. So 3 hours, days, weeks, months. We are putting some fluid into their face, so they'll have about 2 or 3 hours worth of a little bit of swelling. We're putting several spoonfuls of PRP, which is like water, into their face, which quickly kind of absorbs and the growth factors are released. So the good stuff is left behind and the fluid goes away. So that's 3 hours. 3 days for just the minor, general little bit of tenderness to go away if they're a little tender, a little bit of swelling. It's really not bad. Patients are always surprised that it's no big deal. It's really about a month, but we call it 3 weeks just to kind of keep simple, that they'll see the expansion of the filler. So that's when they really see the lifting from filler, the tissue expansion from Juvederm. And then 3 months is where the process of the PRP really starts to stimulate fat and collagen and lifting. So even at 3 months, they're not going to be at their peak. They're going to look better and certainly be happy with it, but they're always surprised to hear us say, remember, you're going to see a lot more. Patients are shocked at a year at how much better their face and skin looks. It helps with the vascularity and the redness in the face. It helps with texture. It can even help with acne. Really, the only thing it doesn't help with is pigment. So the beauty of this procedure is it's not like you do it and then 6 months later you feel like you have to do it again. So it's a very long-lasting procedure. So there's more information on our website about the Vampire Facelift, and if you are an existing patient, we'd love to hear from you about it. And if you're not a patient of ours yet, we'd love to see you for a consult. So thanks for watching. This is the Vampire Facelift at Seiler Skin.